Hello, and thank you for joining me. Our topic today is Beyond Point Solutions. This is about an all-in-one asset tracking platform for 2024, but 2025 and beyond. So our agenda, we've got a decent amount of time, so I'm going to go through current challenges in the industry, what we consider first-gen platforms or systems versus a platform approach, an overview of the Contact.io all-in-one platform. I do want to spend kind of a decent amount of time in the live demo, just showing you what it looks like and what it's like to use and how it can benefit your operations day to day. Workflow integrations is a pretty important piece about how we're going to connect to disparate systems. I've got two case studies I want to talk about with a really large health system and a really small one, so we can kind of compare lessons learned from those two. How this is going to future-proof your operations and also how it is future-proof, and then how we deliver, and we'll move to, at the end, as you've been doing these educational meetings, we'll have like 10 minutes for Q&A. Our current challenges in regards to asset tracking, I mean, I just selected kind of a few. There's way more, and we can probably spend a lot of time just talking about what the issues are. Right on the top, I've kind of listed just time spent hunting assets. And that's for a multitude of reasons that you're going out to look for them. Maybe you need to do some preventative maintenance. Maybe someone said, hey, this thing's broken. I saw it. Yes, but where is it? Okay, now I don't know. Now you're out going to grab it. It's time to clean them. Time to, maybe there's a recall. We need to go find them to replace to get some money back. On top of that, there's roughly 20% of equipment is either lost or misplaced annually. That's kind of an average across all health systems. That doesn't mean they're just walking out the door. Lost kind of means, hey, it's probably in your facility somewhere, but in a dark corner that we're never going to find again. Or maybe we don't want to go into that dark corner. And then another challenge is just the over-purchasing of pumps, because we don't know really how many we actually need, just that somebody is asking for more pumps. Department A, hey, I need more. Supply chain ends up purchasing. It turns out they might have 20, 30 scrolled away somewhere that we just didn't know about. Maintenance and compliance issues kind of ties back to the first point, which is when there are issues with devices that we need to perform maintenance on, it's really hard to find them, and also know, hey, when was the last time we actually touched this device? Rentals is another interesting item. In when you've rented something, you need to return it at some point, and a delay in that is costing some money. So being able to quickly locate those specifically rental assets can really help with your operations and streamline your flow. We'll get to a kind of little rental piece in a little bit. Patient care delays because of all of this stuff that we're talking about. And I put wheelchairs here as a decent example in that if we're not able to find equipment quickly, patients can be sitting for an inordinate amount of time for their next stage of care, whether it's going from the emergency department to inpatient or just being discharged. You've been in the hospital for 3 days, you want to leave, you can't walk out, you must be rolled out in a wheelchair, and now we can't find any because either somebody really liked those and put it in the back of their van and left, or they're out in the parking lot and we just didn't know that they had all left, or there's a host of issues there. All of this kind of attributing to what we've seen across the healthcare industry in shrinking margins. Budgets are really tight, and there's some ways to unlock that. So those are just a few of the challenges that you guys are facing in the industry and healthcare as a whole is. And those issues have been around for quite a long while. This is not something that only popped up in 2024. And there's been a decent number of what we call legacy or first generation vendors that sprung up 20, 30 years ago to solve these issues. And the question we always ask is, hey, did they solve it? Or did we realize a return on that investment? And when I ask that, the answer back is usually no. for a couple of reasons. One is that they were point solutions, which means they might have solved for something very specific from an asset management perspective, but were unable to scale to additional use cases beyond just assets, like managing patient flow, patient journey analytics, staff safety and duress. Other use cases that are critical for hospital operations, but that would require additional network layers and additional infrastructure complexity. And the point solution locked these early adopters into a proprietary technology as well, that it's not open sourced. You're not able to pull in information from other systems and optimize the way you're running your facility, because you selected something that only this company makes. That point solution piece kind of ties into the fact that they were just high cost, partly because they weren't built on open standards. So it was a proprietary technology that only these first generation companies were using, that required a lot of heavy infrastructure to actually implement. And when I say infrastructure, I'm thinking their own networks, cabling. A lot of conversations with people who've run miles of cables in hospitals for one use case. A big burden for IT to have to manage that. There's a lot of hidden cost associated with that. Yes, that first gen system costs a certain amount, but then IT's got to spend a lot of money on networking, extra switches, database management, on-premise servers. So that kind of raised our cost. Another thing driving pricing is just battery maintenance. This is not only a pricing thing, but this comes into our total cost of ownership conversation, and that, hey, we put some tags on some devices so that we could find where they are. Now those tags are dying every 6 months, 8 months. It's actually becoming more of a pain to replace batteries than it was to just manually hunt for assets. You'd have to have a standing PO for battery maintenance to your vendor to say, hey, the batteries are low, can you send us some new ones? You're opening up tags, putting in. It became a burden, and it became such a burden that any potential ROI that you could have achieved from a system regarding asset management is just kind of lost because of the hidden IT costs and the extra battery and maintenance burden that was put on the healthcare operations team. And I kind of already touched on hardware as a tie into the point solution, is they were not scalable to other use cases and not flexible to other technologies. And we contact AO, we think, hey, this shouldn't have to be this way. Getting a system to solve your problems inside your facility, we kind of believe should be three things: simple, affordable, and accessible. And we do this on an all-in-one platform using open technologies or just common technologies. Our primary protocol of choice is Bluetooth Low Energy, and we selected that for a couple reasons. One, it's in the last two words of the acronym BLE, low energy. It requires very little power consumption, so your batteries we're measuring in years and not months. It's also a global standard. There's millions and millions and millions of these devices being created, so it's very inexpensive to make a tag, to make a device. Another advantage of it is that it allows you to leverage existing network infrastructure that is in your facility. So a lot of access points actually have Bluetooth radios embedded in them. So to start an asset tracking program, a lot of times it requires zero infrastructure installation. So extremely lightweight from an infrastructure point of view. We can come in, get a system up and running in a very short amount of time, tying into our ease of deployment. So we've selected this infrastructure that's an open standard. We're using what you have rather than layering on a bunch of stuff that you don't need or want. We don't ever wire. We have no wires. No cabling is necessary. I'll talk about the DIY install for a case study, but spoiler alert, it's very simple. We do it as part of the overall platform package, but during the pandemic had a number of facilities rolling this out themselves in days. It's not a 6-month endeavor to get a system working. On top of those two items, we have what we call the KIO apps. So we're Contact.io, we say KIO, KIO apps, a little fun nomenclature. And we have 20 plus different use cases that we're solving for, with asset management and tracking being kind of the primary, the first focus, whether it's IV pump management, loss prevention, asset tracking for nurses, kind of like a simpler subset of this. And all of this kind of flows down to another solve for that first gen issue, which was if you had a system in place and you were okay with the high infrastructure costs and the point solution, it was really hard to share the data with other systems because it was on-prem. Getting an integration to CMMS or ServiceNow or all these other systems was really difficult. We have, as I mentioned before, an open first philosophy, which means we're working off of very common API protocols. So RESTful is one of them. I'll get that into the integrations, but any data we have from the system, easily shareable to others, and at no extra cost. It's not an additional line item for integrations. It's there, it's waiting to be used. So that was just a little bit about the platform, how it works, but where does it take you? Our benefits of having an all-in-one platform are really simple. It's all about saving time and money. So our number one goal is improving equipment utilization by at least 20%. Across the US, we're seeing specifically for IV pumps, average utilization of the whole fleet is at 30 to 40%. That means there is a huge chunk of pumps that are just not doing anything. They are sitting in storage because we just don't know that they're there, because different departments have been asking for more, and that is a supposed need, and we're responding to that. So improving that by at least 20%, there's nothing stopping you from going beyond 20. Elimination or reduction of rental equipment. So once we're able to shine the spotlight into those dark corners I talked about earlier and reveal where our equipment is, we increase our utilization rates, which means we're using more of what we have, which means we're less likely to need to rent. And I've got a really good case study about reducing or completely eliminating rental equipment. A more than 15% increase in preventative maintenance compliance, because you can get your stuff, get it turned around in a timely manner without having to spend the majority of that time just looking and finding for the things. And bringing your loss prevention down to 0.5%. Telepacks specifically, I think we've seen an average of about 4% of them are lost annually in hospitals across the nation. That's a lot of money. So bringing that down just by a few percentage points makes a really big difference. And last but not least, improving staff productivity. I don't know if anybody was in the Christiana Health conference just a little bit earlier, where she talked about that same piece, staff productivity, all the processes that they've put in place. And one of them was about making sure that biomed is spending time, she called it turning the wrench, because that's what they're really good at, and they can really speed up their processes by just focusing on that rather than wasting their talents wandering the facility. So that's kind of our tie into staff productivity. All right, I promised a live demo. We shall do a live demo. So as I mentioned, our platform is, we call it all-in-one, which means a couple things. We kind of view it as a single pane of glass to look at your entire healthcare operations, and asset management is kind of a part of that. From a deployment perspective, we host everything in the cloud, and what that means is we're infinitely scalable, which allows for you to grow from floor to floor to floor to building to building without having to spin up another instance, without having to manage a separate database. It's very simple and accessible, kind of tying back to the three things I mentioned that are our goals from a product perspective. So it's a single place that you go to. It's not a multitude of applications that you need to download. A single, we call it a tenant that you log into with your single sign-on credentials. And based on your role, you'll have access to a lot of different applications or a narrow subset. And I'm going to go through just a few of them that relate to asset tracking. I mean, you'll see a bunch of stuff on here that I've got up, as I mentioned before, patient flow, workflow analytics, hand hygiene compliance, definitely a big talking point in hospitals today. But I want to spend time focusing on these three items right here. So IV pump, asset tracker, and wheelchair manager. Just a quick note on the why of these three is they're all, the growth of our apps has all come from our partners, our customers' suggestions. Hey, asset tracker is awesome. I've got my transport team. They don't care about anything else but wheelchairs and stretchers. Can we get a separate app for them? And the answer was yes, absolutely. We broke it out, and I'll show you that. But the nice thing about all these apps is if you're a user in one and you move to a different one, there's a very similar experience. They look very, very alike, so it's easy to use. You don't need to, I always call it a PhD in RTLS, real-time locating systems, to actually figure out how to use these pieces. So I'm going to start with asset tracker because it's the most basic one. And this is kind of our, I'll call it a jack of all trades, but it's really a simple place to come find what you're looking for. And this we see mainly used by either supply chain or nurses and providers for a very simple, hey, I need something and let me get my hands on it. So rather than having to call and ask, hey, I need this device, can you grab one for me? Where is it? They can now just log into this application. They'll set their default location as saying, hey, this nurse station on this wing. And every time they log in, it'll take them right to the spot. And now it's just a simple matter of selecting an asset from the left that they're looking for. So let's say, hey, I need a heart monitor. And now it tells me, okay, we've got 4 on the floor. One's pretty close to me. These are sorted by how far away things are from you. So it's not going to send you to one that's on the opposite side of the building, but there's one that's available in a clean room, ready to be used. And we use a lot of room types to our benefit here. So each facility is very unique in this aspect. So we've designed the system to accommodate this. So we assign every room a type. And then we assign specific assets some rules to say, hey, if this heart monitor is ever in a clean room, let's just say that it's available. But if it's in storage or the biomed dungeon, let's say it's unavailable so that they're not being sent to places where there's a dirty or broken piece of equipment. And there's a lot of flexibility to that. Kind of our default values are, hey, it's in use if it's in a patient room or these other areas, or we say it's utilized, maybe it's unknown if it's in the corridor. A lot of flexibility in it, and it's usually just about one call during our implementation phase to kind of go through those room types to make sure that it matches with your facility. Because like I said, everybody's different. Some pieces of equipment too, if they're in a patient room, the status could kind of mean, it doesn't always mean it's in use. So we've got a lot of different ways to adjust that to your specific needs. So the asset search feature is really just a straightforward approach of where's my thing? This is the spotlight that I'm talking about where, if this is probably, this could be in a closet, but we know where it is now because we've put a Bluetooth tag on it. We're unlocking where it is in the facility. In a very easy way. You're not having multiple clicks. When they set their little icon to say, hey, this is my default location, you're able to, the next time they log in, they're able to see this information very quickly. This same piece is, everything I'm actually showing today is available on any device that has a web browser, whether that's a phone, a tablet, a laptop, desktop, etc. So if you're mobile and have a phone with you, logging into the same screen will get you the same results. Very accessible. You don't need to go to a workstation. We also have companion mobile apps right now on the iOS store for hunting for assets specifically, that if you're really mobile and you're not staying at one location, it will use your phone's real-time position on the floor to update the floor with you. So if you started on the first floor and you went to the third and you're like, oh, I need a heart monitor on here, you don't need to select the drop down and go. It'll just dynamically do that because it knows where your phone is within the facility. That's kind of like the first stop from the asset tracker perspective. List view is another area that I used to work at another company where we said live in list. List is your friend. I like map view because you can kind of see an overview of things, but list is usually where you're going to go if you're looking for something very specifically. So here I've got a massive list of really every asset that's been tagged as part of this solution. And I probably should have said this is a demo system. This isn't anybody's real stuff. This is all generated. So if things are moving to rooms that don't make sense, it's just the demo crunching some stuff. So now when we come in here, we're able to search by a bunch of different things. I've got a multitude of columns that are customizable. I have certain groups, which is where we add in our rentals. So I can say, hey, show me all my rentals and where they are right now. I've got 4. They are first, second, and 4th floor. And if I click on them, I can actually get a little map view of where they are. So this one's sitting in the NICU corridor. Especially if I'm not familiar, if I spend most of my time in certain areas of the hospital and I don't go out and about, map view really helps you get oriented, kind of understand where you are. With this, I kind of talked about integrations a little bit before, and we have this section for attributes where we can pull in really any, we'll call it an attribute that is applicable to you, whether that's its serial number, its make, its model, our next PM date. All of this stuff is available here, and searchable as well. So if I head back to my list view and I search by my serial number, it'll pull up that bed 18. So if I'm looking for a very specific asset for a very specific reason, copy and paste the serial number that you know you're looking for, and you know exactly where it is. So an exercise that I really don't know how long it would take you, more than 5 minutes, maybe an hour, maybe 30 if you're really good, looking for something specific, and this might even be impossible. It's in a couple seconds. Serial number, this is where it's at. So that time spent walking. Well, yeah. Oh, absolutely. Yes. So anything that we've got in here is totally searchable. So if you know, so yeah, your existing asset tag number will add, usually I'll put that as its ID. So, and these fully customizable for your facility. So if there's kind of like a common name, I kind of like to use that here. So just something general that everybody kind of knows what it means, but then your specific asset tag, absolutely. We want to put that in here so that when you're searching for stuff, you're using the correct thing that you're looking for, right? Yeah. So fully customizable to you. And also adding it down into the attributes as well. So list view is, I'll say, fully searchable, fully filterable, sortable, a lot of different ways to kind of create this table. It's exportable to a CSV if need be, but by having access to it on your phone, you can kind of just take that with you, and that becomes your spreadsheet. Those assets, they move around, not a whole lot, not as much as people move in a facility, but they do move a lot. So I like to say, hey, stay in the app, because if you have a list of things you want to go find and you download a spreadsheet and go out and look for it, chances are its location's changed. I'm still working on updating paper from APIs, but we're not there yet. So using list view to kind of filter it for what you're looking for the day, and then going out and searching for it. I mentioned map view. you can drill down into a floor, and this is kind of an advanced view of what I showed earlier from a nurse's perspective, where, let me toggle this so we can see a little bit better, where you get a snapshot of where everything is on a floor, and you can customize this down to exactly what you want to know. So what we can do is select any type of asset, and then based on those room rules that I talked about earlier, say, hey, if you're only interested in, let's get rid of a couple of these, I'm only interested in heart monitors that are unavailable, unknown, and we haven't determined what this room is. And I save that, and that's the only thing that it shows up. So if there's this very specific view that you want to just keep up on a big screen so you can kind of have eyes on it at any given time, you're able to do that here with the system. So that, there's a lot of other stuff in asset tracking or asset tracker, but I want to move on to our IV pump management application, which, as you're kind of guessing, same story as wheelchair manager, where great, I know where my things are, but there's very kind of unique workflows to IV pump management, specifically with par levels, that we want to be able to manage and automate rather than having to do some manual effort. So we constructed this IV pump app that from the get-go will show you not only where things were, their current status, their previous history, but where we are in our goal of increasing pump utilization by 20%. So this summary dashboard is, we can customize this based off of certain date ranges. Like I said, we're a cloud hosted application, which means if you've got 5, 10, 20, 30, 40 different hospitals or buildings that equipment are going to, it's all here, it's all centralized. There's not a different application you need to go to find that equipment. And from here, from our summary dashboard, if we're interested in the analytics of what is our utilization, we can drill down as far as we want to, from all buildings to specific ones to a floor, and filter by my certain IV pump types and get an idea of, okay, for the last couple of days, how have I done from a utilization perspective? So right now it's telling me, hey, only 37% of these have actually been in use. We have a great amount sitting in a soiled room, a decent amount sitting in a clean room, a couple that need to be serviced, and a fair amount that are in use, but the big chunk of it just sitting, we're not using them. This is where we can derive insights into how much we need next year or 2 years when we're doing a pump refresh. Par levels for IV pumps, if you're using that workflow, really beneficial to maintain a certain level at certain floors. But as you know, some floors might not need as many as they think they do. We set a 20, and they're only ever using 3 at the most. Nothing ever leaves that par room. And managing this has become very, very time consuming. Got to walk every floor, every room, check it maybe on a clipboard, verifying that, okay, these levels that we've determined, they're set and they're staying here, and we're good. So now we don't need to do any of that. We can just have this up on the screen, and it'll show us based on how we've set it up. Hey, I've got 46 pumps that are critical, 21 that are in warning, and oh, sweet, I've got some spare inventory. That's great. I've got one spare thing. And what we do with this is now I can, let's say I can group this by room. It tells me which rooms need attention. So I can forget about spending time going to rooms just to realize, oh, we're good. There's 5. There's supposed to be 5, and there is 5. Amazing. Now let me go to the next room. Now we can at a glance just see where we need to spend time. Where do I need to go? I need to go to the anesthesia workroom supply, because this IV pump, we're out of par. We're at 0, and we should have a few. Filtering by our entire campus to locations, to different rooms. This one is set for today, so it's a certain timestamp of right now. What is the status of all of my, specifically IV pumps? There is a whole, all this information is available via a whole history And this helps watching your trend lines to say, okay, we've been above par for the last 300 days. We should make an adjustment. Let's bring that down, monitor, and see. Okay, we actually got away with 5 less in this floor than we did previously. And the interactions here from a utilization perspective are important from kind of like the provider side of things. Is as PARs are maintained, they're getting a little more confident in that stuff will be there when they expect it to be. So hopefully we're reducing kind of the hoarding tendencies of, oh, I've got an IV pump, I know it's clean, I'm gonna put it over here, and then they forget. And now we've got 20 underneath this desk here that nobody knows that they're there. So that we're, again, shining the spotlight on where this equipment is and what it's doing, either just sitting idly by, in a patient room, in a repair room. All that information is at our fingertips, and really in a manner that we can just see easily where do I need to focus on. The breakdown between critical and warning. Warning is simply, hey, we're about to hit your PAR. Critical is we've hit it and we're above or below what we've set. From an IV pump perspective, there is the same list view that you would expect in your asset tracker app, so you don't need to leave IV pump and go back to asset tracker. When we set up the system, they're both running simultaneously. So any assets that we import with their asset tag IDs, with their make, model, serial number, next PM date, it's all going to be the same across all apps. Each one is really just showing you the information based on your persona in a slightly different way. So IV pump manager, more geared toward clinical engineering, biomed, supply chain, those who have a lot to do with the equipment. An asset tracker, more to do with, I just need something regardless of my persona right now and very quickly, such as nursing, providers, etc. Let's jump to wheelchair manager. And if you haven't noticed, I hope you see now, very similar look and feel. So now that we know how to use asset tracker, we're familiar with how IV pump manager looks like. It's almost a carbon copy, but specifically for wheelchairs. So the same idea here of, hey, how are my wheelchairs being utilized? Are they spending most of the time outside the building or needing repaired, or are they actually sitting in their little cubby waiting to be used and not actually being used? We can search for specific ones. The PAR level status is a really important one to solve for that the patient care delay perspective that we talked about a few slides earlier in regards to I'm a patient waiting to leave, and really the only thing stopping me is just finding a wheelchair. So maintaining transport equipment on specific floors via simple PAR status is really beneficial for that workflow, for the flow optimization. I will also spend a little time, get this bigger. Let's jump back to asset tracker and talk about alert rules. So mentioned loss prevention. Hey, things are leaving the building and they shouldn't. Telepacks are wrapped up in linens and thrown away or sent to our cleaners and they've never come back. How can we stop that? So one of the simplest ways is just create an alert rule based on what you're trying to stop from leaving. So I'll just say, just hit create alert rule. And we'll just call it telegone. And I'll apply it to, I don't know if I have telepacks in our little demo system. We'll just select the type of, just pretend with me that this says telepack. And I'll go next and say, okay, so now I've got, give it a name. What does this apply to? Hey, just any telepack. And I could also, if there's, well, let's talk about it we could just say patient transport monitors. If there's a select group of, hey, this is our ICU or our ED only ones, we can even drill down really far into the type of asset and its current status. And now I can say, okay, what do we want to trigger off of? What are the conditions for this? So I'd like to do, hey, if this just exits my medical center of General Memorial Hospital, if this just leaves the building, then let's execute a bunch of actions. Really popular ones are just webhooks. Hey, hit me at Slack or Teams, whatever messaging system you're using. A little pop-up will occur and say, Telepack 1 just left. It was last seen at this doorway. Go retrieve it. Simple messaging or simple ways to get information out, whether that's through text messages or emails. I like text or webhooks, unless we're monitoring emails very consistently. Those kind of get lost in the shuffle. It'll also alert in the app. So if you have it open on a screen, it'll make a very annoying dinging sound and come to you on the alerts list where you can acknowledge that, hey, I went out and actually grabbed this, put a little note, and come back. That's just building exit. Sometimes it's almost better to trigger alerts based off of where something went in the building. So, oh, cool, emojis. If we go to alert name tele, let's select another asset type, which is we'll keep using our transport monitor. And now I can even identify soiled rooms or kind of our laundry room or our loading dock and say, hey, if anything actually enters that area rather than just leaves the building, let me know, because that's kind of like a precursor to it going to somewhere you don't want it to do. So now I just come to my room types. I think I should have a loading dock in here. We'll just say a restricted area. And then same exact thing, what are my actions? So a lot of flexibility on these conditions based on your workflow. Say, hey, if I don't ever want clean IV pumps that have been clean enter this other area, or the reverse, a soiled one, enter a patient room, let me know. A lot of customization in these alert rules. And we're using this at a few facilities to automate tickets. Another thing that was mentioned in the Christiana health conversation earlier, in that a lot of phone calls being sent from nursing say, hey, this might not be you, but this piece of equipment's broken. How do I open a ticket, or where do I do that? Or they just might not have time to. We can now automate all of this stuff simply by doing two things. One, when an asset moves into a certain room, let's say we designate an area as the broken things go here, then when they go there, we can automatically open a ticket in your work order system to say, this asset is here, it's down. Now, truthfully, it's not going to tell you what's wrong with it, but at least you have your hands on the broken thing. And I'll show it afterwards too, but our tags also have buttons on them. So it can be a very simple, hey, if you're wandering around the facility, you notice this bed is completely broken, just press the red button on the side of it and it'll automatically open a ticket. And we'll be sending its live update. I mean, I do know beds go lost and they do move, but it'll give you its live location of where it actually is. So just kind of optimizing those simple productivity pieces so that you're not inundated with a lot of equipment throughout your facility that's just sitting by, broken, or underutilized. So alert rules, we do a lot of training on to enable you to be able to use this at your leisure. Hey, you know what, it would have been really nice if I could get an automated notification when this specific type of device comes in, because we have a very special process for how to handle this. Automatically open a work order, send a message to Teams, a lot of stuff that we can do with it. All right. There's definitely a lot more to talk about from the app's perspective, but for the sake of time, we'll move on to the fun slideshow part of this. And kind of after all that, we've set our current challenges, we've set the how we solve them using our applications, using existing infrastructure, and now it's kind of like, okay, where to start? And we've really boiled this down to 4 simple steps. I really mentioned this a lot, but I'll say it again, is starting with the network is kind of our first step, is just identifying what existing infrastructure is in the facility that we can utilize right now without having to bring in anything. Case in point is Cisco BLE access points. All the latest Cisco access points have Bluetooth embedded in them. We're an OEM partner with them and help them with that. We work with a ton of other Wi-Fi vendors, so it's easy to just assess, hey, what's your current infrastructure? Because we might not need to bring anything to put in place. We can give you 100% room level accuracy where you need it. So I like to look at your people and your processes, and then assign you a specific technology based on that. So if you have a very specific use case to say, hey, I really don't care about PAR, I just need to find my stuff, great. Then 100% room level accuracy, it's not gonna have a whole lot of benefits for you. You're starting from nothing and really wanna shine the spotlight on stuff. But if you say, hey, I really want precise alerts, precise triggering of events, I need to maintain PAR, then we'll provide room level accuracy for you. But again, no cabling, period. We're not here to run miles of cable in your facility. Everything's centrally managed in our secured cloud environment. And from a systems perspective, we're monitoring it constantly to make sure that it's up and running. So downtime isn't something that you have to report to us. We've got one of the best cloud uptimes in just the cloud industry in general. On our status page, I think for the last 6 months, we're still at 100%, which is just above our SLA. And as part of this network, it's a fully managed service that includes the batteries for any, or in replacement of batteries for any room level sensors that we need to put in to accommodate your use case. Then step 2 is selecting your medical devices, like which ones we want to focus on. So primarily, see a lot of folks going with IV pumps first to automate their PAR management, to integrate with additional inventory management, and we can use this is kind of really the biggest cost saver from an ROI perspective, freeing up a lot of man hours for searching, because these are high volume assets that are moving around a lot that we need to put our hands on a decent amount. And then also, as I showed that nurse interface, what we've kind of determined is that if we go with medical device, if we go with IV pumps first, we're seeing about a 20-minute time saving per shift per clinician, which if you extrapolate it over a year, it's a lot of time for nursing to get back to the bedside, back to taking care of patients and not worrying about having to find medical equipment. So for IV pump scenarios specifically, we're typically providing an ROI in about 7 to 12 months from go live. And that's a return on the investment of the system for just IV pump assets, an increase in utilization, time spent looking for things, the improvement of your processes. Same thing applies to, as our next step, roll out to beds, stretchers, other assets, IT assets in particular, like iPhones that nurses are using, or phones and tablets. Not being paid by Apple to say iPhones, apologies. And then just really any medical equipment that you want to roll out along with or after IV pumps. And our fourth item being that piece we talked about for loss prevention and rental reduction. Really beneficial. So a couple statements here. We secured rentals, but now they're sitting idle. Utilization-based billing is an advantage, but how do we capture utilization? So if you're being charged on actual utilization, now you have a system to give you 100% accurate data on where that asset has spent time. Because it could be a good chance it wasn't utilized at all, and now that's some cost savings that can be recouped. Moving beyond our application, and this kind of ties into the platform that I keep mentioning, is how we can create different integrations with our open APIs. A lot of different ways to send information, and where that data lands is totally up to you and your workflows. A couple that I like to mention, ServiceNow, very easy integration. Integration makes it sound more complicated, I think, than it is. It's very straightforward, especially because they've got a lot of low code capabilities, just like us. So talking together is very simple. Sending information on request They ask my system a question, I ask their system a question. We're transferring information to make your workflows more optimized. Webhooks is how we really easily, and when you saw we were creating alert rules, sending a message that needs to be read pretty quickly. So Teams, kind of a big one. Any other messaging service that you're using, and then even just simple messages, text, email, and our notifications in the app as well. And last but not least, HL7 and Fire. So integrating with Epic, where that will provide benefit for your facility. So 2 case studies. We'll start large and then we'll go small. HCA has been a really good case study for us. It is a really good story to tell because they had a challenge. And that challenge, as you might guess, is just all of those things that I listed at the beginning of this conversation regarding medical device availability. They were just having issues with where equipment was and making it available. So their solution was implementing Contact.io. That's us. And what they saw from that was a 30% improvement in the availability of devices for nurses, so that it was there when they needed it, freed up 22 minutes per shift for their nursing staff just by having that utilization increased. And they achieved an ROI doing this in just less than 28 weeks, a return on their investment of this system in a very short amount of time. Reduced their active rentals by 75%. They had a huge issue with rentals. That was like a very large portion of their fleet. They reduced it by 75%. And they've realized 7 times every year. They're an annualized hard ROI that they've calculated themselves. So really the big lessons learned from our HCA deployment is that common statement of people, process, and technology. They took a look at who are the people involved in medical equipment, what are our current processes, and then how can technology help them solve that problem? Not the other way around, like, oh, hey, there's this cool technology, how do I shove it down people's throats to make something happen? Let's look at the people and processes first, make sure it aligns, and then select the appropriate technology. Scalability is a huge factor. So we're cloud-based. We have almost 200 hospitals on a single instance. So the information they're getting is from their entire enterprise. This is not from separate buildings that their business intelligence team needs to cobble together to prove ROI pieces. This is all on one platform, one single pane of glass. And then our lessons learned, almost forgot, our continuous improvements is we have a very active engineering team, and they're constantly making improvements to our location algorithm to improve not only specific workflows, but specific use cases. So if there's an edge use case for a specific type of device, they'll tune the algorithm to just be better responsive to solve for that. Riverside Health is a really great example of how you don't need to be one of the largest health systems in the US to realize some benefits. They self-installed our system during the pandemic. So we shipped them devices, they did everything themselves. They saw a 27% increase in their utilization within 6%, and then an improvement in their preventative maintenance compliance because they were able to get their hands on things. And the lessons learned from here is it just really, to deploy these solutions, it just does not need to be complicated like it had in the past. It's very simple to do. Riverside proved it. We sent them devices, they installed it in a couple weeks, and they're up and running. The cloud really enabled that. It was super easy to deploy. They just log into a certain area, and boom, they've got a fully functioning solution to work from. And then the last piece here, I mean, I guess this is kind of a lessons learned for HCA as well, but the fast install helps you realize your ROI much quicker because you're not spending time 6 months to a year running cable and installing expensive infrastructure, and because you're still losing medical equipment during that installation. You're still suffering from the same challenges that we talked about before. So what does this look like for the future? So we want to be future-proof for you, and that means scaling with your needs based on your processes and your people. So this year, 2025, well, next year, 2025, we want to solve your medical equipment issues, increase your utilization rates, decrease the amount of shrinkage you have. And then from there, we look at really anywhere else in the indoor domain, because we're not just purely focused on asset management. There's a lot of use cases to solve for here, and we want to grow with you and partner and come up with new and exciting ways to optimize your processes. And the cloud enables us to do that because we don't need to deploy very specific programs locally to run. It takes a very short amount of time to spin up a new app and deploy it on the cloud. So we can move very fast for your specific use cases. From an integration perspective, looking into the future, RESTful is a very common protocol. It allows for a very easy exchange of information. So any modern system that we want to build an integration with, it's very simple and doesn't really ever involve engineering time. I do most of that work. I'm just our sales engineer, so not super technical, but I can make things work, and it's very short amount of time. I've had a few customers. We went live with staff safety deployment, and then 6 months later they had realized, oh, we've got this other notification system. Can you send it to there? The answer is yes. It was a 15-minute call to set up an outbound message to that system to receive it. No charge. Now they have a much better process, much better workflow using all of the stuff that they have. I mentioned before HL7 and Fire into Epic. Everyone loves Epic. Oracle as well. These are easy ways to automate workflows, whether it's from changing a room status based off of the location of a patient or the location of an asset. A lot of workflow automation that can happen from systems that previously were siloed that we can now bring together and talk. Right now, we've got 20 plus use cases, getting closer to 30, so we'll be able to update this in a little bit. And we're looking to add more based off of specific problems that you might be encountering, whether it's asset related or something else. And that ties into our really extensive application roadmap. We right now believe we're that single pane of glass that you can look at your hospital operations and determine what changes need to be made and how to increase your patient throughput, your own productivity, etc. Always looking to the future to be able to make that happen. So how do we deliver? Very easy and accessible. We will come out and find, very critical component, and tag up to 75% of your equipment. We spend less than 4 minutes inside of a patient room. And that's really important because that kind of underscores how long it takes us to install, a very short amount of time, and how little impact there is on your interactions with patients in your operations. We don't need to shut down a wing or move patients, hey, don't put a patient in here. I need to spend a day installing my RTLS system. No, we're in and out very quickly. And usually we're at about a 30-day install schedule for a 200-bed facility. And that means from kickoff to closure. So usually it's about 10 business days actually on site doing stuff for a 200-bed facility. So it's not a month of effort. It's a really short amount of time because the cloud deployment takes no time at all. Being on site is really the longest part, and we can do 10 days. That's a really, really impressive number. We have our monitoring tools to maintain the health of the system, to make sure it's working optimally so you're not surprised by anything. Kind of taking that maintenance burden that was previously on hospitals onto us. So we're monitoring battery levels, we're monitoring the health of the system. There's no tuning that needs to occur on site every month or so. The system dynamically does that itself. So it's a turnkey installation. It's a managed service. Everything comes included, whether it's the little things we need to put on assets to all the different applications I showed. I don't sell wheelchair asset and IV pump separately. That's just the package, because we want to be focused on providing you with an outcome, which is increasing utilization rates, keeping things from wandering out the building, making you more productive. We're not in the business of selling little things to put on tags. I want to give you this platform that will help you change the way you operate. And last but not least, it's a journey. So we're doing all this together. Like I kind of underscored, we want to partner with you to solve as many problems as possible. We're here for the long haul. And as part of the service, we've got our customer success manager will be alongside. Every specific hospital's got their own to make sure that the system is operating as intended, but also, hey, we've noticed your utilization has increased. Let's make recommendations now to remove some equipment, to get rid of some rentals, etc.